From the Centers for Disease Control and Prevention Import Permit Program in Atlanta, Georgia, welcome to the Federal and International Partners Import-Export Regulations webcast. Good afternoon. I am Lourdes Mueller. It is a privilege to be this year's moderator and a pleasure to welcome our exciting guest speakers this year. The webcast is the Import Permit Program's outreach to our nationwide users since 2013. We are happy to continue serving our importers. This year's webcast is a two-day event. We have expanded our list to include presenters from the Department of Agriculture, Animal and Plant Health Inspection Service, the Department of Commerce, Department of Health and Human Services, to include the Office of the Assistant Secretary for Preparedness and Response, Customs and Border Protection, the Centers for Disease Control and Prevention's Division of Global Migration and Quarantine, the Division of Select Agents and Toxins, and a speaker from Food and Drug Administration. We also have speakers from the Department of the Interior, Fish and Wildlife Service, the Department of Transportation, and the Public Health Agency of Canada. Our agenda for today is shown in this slide. We are going to have a break for 10 minutes. And at the end of the presentations, there will be a question and answer session. Housekeeping, if you have questions for the Q&A session, please send them or email them to ipwebcast@cdc.gov. Should you experience any technical difficulty, please contact your IT department. Our first speaker for today is Glenn DeGrew. He is the Acting Chief, Program Services Branch, which includes, among others, the Import Permit Program. Glenn will walk us through the import permit regulations and requirements. He will give us an overview of the import permit regulations.
Thank you, Lourdes, for the introduction. So today I'll provide an overview of the CDC's Import Permit Program. So the Import Permit Program regulates the importation of infectious biological agents, infectious substances, and vectors. The following infectious biological agents, infectious substances, and vectors will require a permit prior to entry into the United States. An infectious biological agent is a microorganism or prion, or a component of such that is capable of causing communicable disease in a human. An infectious substance is any material that is known or reasonably expected to contain an infectious biological agent. Finally, a vector is any animals, including arthropods, or any non-infectious self-replicating system or animal products that are known to transfer or capable of transferring an infectious biological agent to a human. A person may not import into the United States any infectious biological agent, infectious substance, or vector unless it is accompanied by a permit by the CDC. The importer is in compliance with all permit requirements and conditions, and the importer helps to ensure the shipper complies with all legal requirements, such as Department of Transportation regulations and IATA guidelines. Finally, the importer has implemented adequate biosafety measures. For material that does not require an import permit, each shipment must be accompanied by a signed certification statement. And that statement must include a detailed description of the material and a statement on official letterhead that's signed by the recipient that clearly states that the material is not known or suspected to contain an infectious biological agent. Also, how the person making the certification knows that the specimen does not contain an infectious biological agent, or a detailed description of how the material was rendered non-infectious. The following items do not require an import permit. First, select agents, which will require a Form 2 from the CDC. Diagnostic specimens that do not contain an infectious biological agent. Animal or animal products being imported for educational, exhibition, or scientific purposes. Finally, nucleic acids that cannot produce infectious forms of any infectious biological agent. The above is with the exception of live bats or bat or non-human primate products. The CDC Import Permit Program receives applications requesting importation of emerging agents or in response to outbreaks. When the Import Permit Program receives a request for these agents, they are given an expedited status. If the application meets the requirements, the import permit is released within 24 hours. Other than Zika virus, the following is a historical example of agents that have fallen into this category. Applications expedited, 24-hour release. Middle East Respiratory Syndrome coronavirus, or MERS coronavirus. Avian influenza A virus, H7 and 9, or materials suspected to contain the Ebola virus. And finally, Zika virus, which currently holds an expedite status. We've had 133 approved permits for Zika virus between January 1st to July 15, 2016. Common application descriptions, the type of work, are usually diagnostic testing and research, as well as vaccine development. The specimens that are imported are most currently human blood and body fluids, laboratory isolates, and mosquito pools. In a common center location with the United Kingdom and South American countries such as Brazil, Colombia, and the Caribbean. So what's the big picture? The CDC Import Permit Program provides active oversight to prevent the introduction, transmission, or spread of communicable diseases from foreign countries into the United States. This is accomplished in part by reviewing and approving import permit applications, which is an official document that captures information relevant to the infectious material being imported. Also, conducting inspections, which is used to verify information provided on the application, as well as verifying that appropriate biosafety measures are in place. So let's take a look at our application. Our application is separated into different sections, and we'll begin with Section A. Section A captures the importer or the permittee, and it requests information such as the name, physical address, organization, and contact information. Section B captures the sender information, which requests the same information but from the sender. Section C captures the shipper information. And the shipper information discusses the method of shipment, number of shipments, temperature, and port of entry. And finally, Section D is our final destination, if the material is going to be moved from one location to the next. Section E of our application is a description of biological agent. Its intended use, work objective, and agent information is captioned in this section. And Section F is a description of material containing the agent, such as the source of material. Is it a human or vector? Type of material. It's going to be blood or body fluids. And finally, Section G is the receiving laboratory's capabilities. What biosafety measures are in place? What sort of primary containment would be used? What PPE would be used? And what training you have in place? Common problems that we've noted with the applications are individuals requesting to work on an open bench or even work in a fume hood, which both offers no protection from biological agents. Also, we've noted work at an inappropriate biosafety levels for the agent being requested and work with minimal PPE or minimal training for staff. The above will lead to further investigation by the import permit team. Next, we'll look at our inspection program. So the inspection program is to verify the accuracy of the import permit application and that the importer has implemented adequate biosafety measures. The criteria used to determine if an inspection may be required is based on risk. We'll look at the biological safety level where work will be conducted. Also, we'll look at the risk of the agent and the work being conducted. So for example, if you're conducting work with high-risk agents such as Mycobacterium tuberculosis, chikungunya virus, yellow fever virus, or any novel viruses such as Middle East Respiratory Syndrome coronavirus, or influenza H7N9, your application may require an inspection from our program. If you are conducting work with high-risk studies, such as aerosol studies, or working with large quantities or high concentrations of virus, you may require an inspection from our program. You may not be inspected if the laboratory has been inspected by the Federal Select Agent Program. So we begin the inspection process by having a notification of the inspection. And in this situation, we'll contact the permittee by phone to coordinate the inspection. And during the phone call, we'll discuss a date of the inspection and the duration of the inspection. The duration of the inspection is determined by the number of laboratories to be inspected and their respective biosafety levels. And we'll request the following information from your facility. We'll request a copy of your biosafety plan, your personal protective equipment requirements to gain entry into the laboratory, your laboratory floor plan, and any entrance requirements that are needed by inspectors, such as vaccines or PPD results. And finally, we will want to know directions to your facility. When that information is gathered, we'll send out an official notice of inspection letter via email. This letter will include our authority to conduct the inspection, a confirmed inspection date, identification of inspectors who will conduct the inspection, and a list of items that we will review while on site. On the first day of the inspection, we'll have a brief introduction period. During this time, inspectors will explain the purpose of our visit, and we expect the entity to provide an overview of the work being conducted. After that meeting, we'll begin our laboratory inspection. So our purpose is to verify that biosafety measures are commensurate with the hazard posed by the infectious biological agent, infectious substance, and a vector to be imported, and the level of risk given its intended use. So we will look at your physical structure and features of your facility and operational and procedural safeguards. We will look at your facility design to verify adequate secondary containment. Furthermore, we'll evaluate your safety equipment, such as your biosafety cabinets and storage containers, to verify adequate primary containment. In addition, we'll evaluate your standards and special microbiological practices while on site. So inspectors will verify the following, usually using the nationally recognized biosafety standards, such as those contained in the Biosafety and Microbiological and Biomedical Laboratories, BMBL 5th edition, for BSL-3 labs. We'll look for readily available eye wash stations, ducted air ventilation systems, availability of an autoclave, HEPA filter certifications, hands-free or automatically operated sinks, and annual biosafety cabinet certification. Please keep in mind, this list is not all-inclusive. For biosafety cabinet certifications, we'll verify that the following tests are performed by your certifying organization. HEPA filter leak testing for all biosafety cabinets. Class 2 cabinets, we'll make sure that your downflow velocity, face velocity, and airflow smoke patterns were evaluated. In addition, we'll verify negative airflow via smoke testing, and we'll make sure that there are methods to confirm directional airflow in your laboratory, such as magnet Healy gauges, digital gauges, or ping pong balls. And we'll view HEPA housing and exhaust fans as well. And we also request the following documentation: your decontamination procedures, any failure testing that you've conducted, and facility re-verification procedures. In addition, we will also evaluate your practices and procedures, such as practices to ensure that aerosols are minimized, hand washing procedures, decontamination and waste handling procedures, the proper use of a biosafety cabinet, laboratory and entry and exit procedures, spill procedures, and biosafety training. We ask that a location be made available for inspectors to review documentation, discuss findings, and complete respective checklists. So during the closeout meeting, we'll inform the entity of any deficiencies that we've noted. We'll be happy to interpret any safety standards for departures, and we'll be happy to answer any questions that you may have while we're on site. After the inspection, we'll be followed up by an inspection report. And this report will be emailed to the permittee within 1 to 2 weeks. The report will include our observations that we've noted during the inspection, and also a request for further information. A written response to the inspection report should be provided to CDC within 2 weeks of receiving our report. The next document is called an adequate response report. And this report is written by the CDC when additional information is required from the report sent from the entity to the CDC for evaluation. This report will be sent to the entity within 1 to 2 weeks, and a response is required from the entity within 2 weeks. And the final document during the inspection process is called the adequate response letter. This will be sent when all inspection deficiencies are adequately addressed. The letter signifies that the report is closed and no further information is required. If there are no major changes made to an application or the permittee may not be inspected by the Import Permit Program for up to 2 years. So our inspection program has completed over 120 inspections since April 2013, and we've inspected the following: Biosafety Level 2 and Animal Biosafety Level 2 laboratories where work occurs with agents posing moderate hazards. In those laboratories, we expect to see access restriction and aerosols or splashes worked within containment devices. Also, we've inspected arthropod containment Level 2 laboratories where work with arthropods infected with BSL-2 agents occurs. And finally, we've inspected Biosafety Level 3 and Animal Biosafety Level 3 laboratories, which is suitable for work with agents that may cause lethal disease through the inhalation route, and we expect to see special engineering features in place during these inspections. The common descriptions of work associated with import permit inspections are usually human diagnostic testing, susceptibility testing, animal studies, and molecular biology research. The most common agents that are imported are by far Mycobacterium tuberculosis, including both multi-drug resistant and extensively drug resistant strains. Also, chikungunya virus, as well as Zika virus. Common safety departures that we've noted on inspections: donning and doffing procedures, individuals mixing clean and dirty areas, or inadequate procedures detailing donning and doffing. Visitor training issues, where the visitor is not informed of the hazards of the agents prior to entering into the laboratory, or agents stored in inappropriate containers that cannot be adequately disinfected or decontaminated. Inappropriate signage being posted, where information is missing, such as the biosafety level, contact information, and entry and exit procedures. Failure testing either not being conducted or conducted inappropriately, or facility re-verification not being conducted. So in conclusion, the Import Permit Program prevents the introduction, transmission, or spread of communicable diseases from foreign countries into the United States. This is accomplished in part by reviewing applications, over 3,000 reviewed and under 2,000 approved annually, and conducting inspections, which are conducted 30 to 40 inspections annually. I'd like to take the time to give our website, www.cdc.gov/OD/EAIPP/. There you can access frequently asked questions, the import permit regulations, the inspection checklist that we use while on inspection, and the import permit application, and a guide for shipping infectious substances. Thank you.
Thank you for the comprehensive information, Glenn. Our next speaker is Dr. Kendra Stoffer, Team Lead for the Importation and Animal Contact. She is a diplomate of the American College of Veterinary Preventive Medicine, and she will talk about importation of selected animal species and enforcement of CDC DGMQ's import permit requirements. Dr. Stoffer?
Hopefully this will make it a little easier for the folks that are on the webinar to be able to hear me. So good afternoon or good morning, wherever you're logging into this webinar. We just heard from our sister branch, Division of Select Agents and Toxins, and within CDC there's out of all of CDC, there's only 2 parts of CDC that have any regulatory components. One you just heard from DSAT, and the other one is from DGMQ, which is the Division of Global Migration and Quarantine. And within that division, there's a smaller team, which is the team that I lead, Importation and Animal Contact Team. The mission is pretty simple for our branch. It's basically to protect human health. So we do that by preventing the introduction and spread of communicable diseases. We also do that by enhancing our partnerships that we have with our federal, state, and industry stakeholders. We also enforce our public health regulations. As a team within the larger division, we are really focused on preventing the introduction and spread of diseases of public health significance to humans from imported live animals or cargo containing infectious animal products. This is just an organogram of our small team. So I lead the team. We have 1 other medical officer and then 3 veterinary medical officers here at headquarters in Atlanta. We also have a public health advisor at headquarters. And then we have public health advisor field officer in our New York JFK station. Why do we care here at CDC about animal imports? We care about it because, as you will hear from several of the other groups that are going to present today and tomorrow, there are a lot of animals moving into our country. Healthy animals mean healthy people. So we try and make sure that the animals being imported are healthy so that they do not affect the health of our population. We just heard about import permits. What we do at DGMQ, and with the import impact team, we do issue a few permits, but most of what we do is issue permission letters. And we issue that based on, we restrict live animals and we restrict animal products. The enforcement of our import regulations at our ports are through our quarantine stations and then with our partnerships, specifically with U.S. Customs and Border Protection and other federal, state, and local agencies. So to get a little bit down the weeds and get into the Code of Federal Regulations, if you're interested, these are actually our specific regulations. It's in Subpart F of CFR 71, and I will talk further about each of these individually. We issue letters of permission, and they restrict the live animals. Most of CDC's, actually all of CDC's regulations have been put in place because of some major public health impact, importation, disease outbreak, and over the years, you'll see as I go through this that they're in response to a majorly imported, or a massive import of disease, such as SARS. So restricted live animals are from civets, in the family of Viridae, freshwater turtles, tortoises and terrapins, non-human primates, and African rodents. Our animal product restrictions are from the species that we have restrictions already put in place upon. So from civets, non-human primates, African rodents. And you just heard before, bats actually are underneath DSAT's regulations. So dogs and cats. This is probably the most common regulation or questions about the regulation that we have. Dogs and cats must be healthy upon arrival at the port of entry into the United States. Animals that are ill upon arrival may be required to be taken off or taken for examination by a licensed veterinarian at the importer's expense. Our main focus is rabies and rabies control. For cats, they have to be healthy, but we do not require a rabies vaccination. For dogs, we do require proof of current rabies vaccination. Puppies must be at least 3 months of age when vaccinated, 12 weeks, and vaccine must be given at least 30 days before entry. Unvaccinated or improperly vaccinated dogs may be allowed entry into the country, but only on a case-by-case basis. The email address provided, you will see throughout this presentation, is our main way to contact us. Applications must be submitted in advance by sending a request to this email inbox. Decisions are again made on a case-by-case basis and depending on the country of origin and the risk that country's rabies status may have to our country. Freshwater turtles, tortoises, and terrapins. This is one of our oldest regulations that go back to the 1970s. So this was salmonella infection outbreaks in children associated with contact with small turtles. The 4 inches comes from the fact, or the size of the turtle that can be easily put into a child's mouth. So for commercial purposes, turtles with carapaces less than 4 inches may not be imported. Viable turtle eggs may not be imported. For non-commercial purposes, up to a total of 6 viable eggs or live turtles with carapaces less than 4 inches may be allowed. More than 6 allowed for science, educational, or exhibition purposes with CDC permission. We do not have regulations regarding sea turtles. Upon admission to the United States, turtles less than 4 inches in length become subject to FDA restrictions. Please submit all request letters to this email import box. Non-human primates. Regulations were really strengthened in 1990 following the 1989 Ebola resident outbreak in the United States. We revised our regulations further in 2013. Viral hemorrhagic fever in a group of imported non-human primates occurred in 1989, and it was an outbreak of Ebola restin. First thought to be simian hemorrhagic fever, we soon realized that it was not that, but the illness had already spread to monkeys at the facility, and over 500 animals were euthanized. 6 people associated with this outbreak seroconverted, but no human illnesses were detected. Currently, only non-human primates can be imported only for science, exhibition, or education, and they must register with us at CDC. They also undergo a quarantine of 31 days, and they also must have 3 consecutive negative TB skin tests at least 2-week intervals. So to import live non-human primates, you must register with us. They're only allowed for science, education, or exhibition. And for more information on how to register, please use this email box. Prior to the 1990 regulations, this is how non-human primates primarily came into our country. As you can see, it could be mixed with a lot of different other cargo. Primates could be stacked on top of each other haphazardly. This is not good for the animals, and it's definitely not good for the people involved during this transit from wherever they originated from coming into our country. After the 1990 regulations, you can see it's much more organized. It's safer for the primates and safer for any of the handlers as these animals are transported into our country and through our country. Non-human primate products. These consist of trophies or souvenirs, diagnostic or scientific samples, or others. An import permit is required. This is where we will actually give a permit and not a permission letter. Products may be imported without a permit if rendered non-infectious. Shipment must be accompanied by the statement of how the products were rendered non-infectious, usually and using one of the methods listed at this website URL. The permit application process, again, they're only allowed for science, education, or exhibition. You apply for the permit through CDC through the IPP program you just heard about. DSAT, who oversees that program, will then actually route the application to us for approval. This is why it's important. Since 1990, the non-human primate import program and the regulations regarding the importation have resulted in a drop of morbidity and mortality to less than 25%. Imported animals from 25% prior to 1990 to a current rate of less than 1%, resulting in lower potential risks to the US public and in a healthier non-human primates for research. So again, it goes back to that, if we keep healthy animals, we keep our people healthy. Civets in the family Viveridae. This goes back to the SARS outbreak in 2002-2003. Civets were originally linked to the SARS transmission. Emergency embargo was effective January 2004. Civets are still covered underneath the embargo. And it includes all members of that family. It does not include the African palm civet, though, as it is from a different family. Products may be imported without a permit if rendered non-infectious. And again, you want to make any request about reporting any member of the family Viviridae to this email inbox, and information is available at this URL. African rodents. Restrictions followed a 2003 monkeypox outbreak in the United States. And for those of us who are working in public health or on the animal side of things, this was a major outbreak for us. Again, you can see the lesions look very similar to other pox viruses, such as smallpox. So this got the public health attention very quickly. It was linked to African rodents imported for the pet trade. A total of 71 human cases were investigated. First human monkeypox cases reported outside of Africa ever. Immediate embargo and domestic ban by Health and Human Services, effective in 2003. International import embargo, later codified as a regulation, 42 CFR 71.56. FDA domestic interstate movement restrictions were lifted in September 2008. It includes all African rodents, and this is probably one of the regulations we get a lot of questions on. It's all African rodents imported directly from Africa or born in Africa, even if imported from a third country, and all rodents with a native range that include Africa, even if born outside of Africa. So basically, it's African rodents from the entire continent, not from any particular country within Africa. Applies to live animals and animal products. Products may be imported without a permit if rendered non-infectious. Shipment must be accompanied by a statement of how the products were rendered non-infectious by one of the methods listed at this URL. Permission letter should be sent to this email inbox. And again, we're only allowing entry for science, education, and exhibition. Enforcement of our regulations. We do have quarantine stations around the country, and they are really managed with a lot of our partners that are sitting in this room today and that you will hear speak. We cannot do enforcement of our regulations without these important partners. They execute federal authority for quarantine, isolation, and communicable disease surveillance at our U.S. ports of entry. As you can see, there's a lot of different places for animals and humans to enter the United States. And our CDC quarantine stations, we only have 20. And this is just a better map of where our quarantine stations are and the jurisdictions that they have. And we are often embedded or right next to or within the confines of the federal space within these ports, usually standing side by side with CBP. We provide support to U.S. Customs and Border Protection at ports of entry regarding the CDC-regulated products. So when they have questions about anything that falls underneath CDC jurisdiction, they can reach out to us, either locally at the ports or here at headquarters for clarification. We coordinate a lot with our federal, state, and local agencies as needed. Unlike, CDC is a recommendation agency primarily. Like I said, we have 2 small groups within CDC that actually have some regulatory authority, so we rely a lot on our partners. We coordinate with CDC Import Permit Program to ensure that CDC restricted imports have proper permits or documentation. And again, with any assistance, this is our URL, and we're happy to take any questions to that email inbox. So the upcoming year, I did want to take a little bit of time to talk about that. We are going through a massive updating of our website. APHIS just did a wonderful job of updating their animal importation and exportation website, and we have realized that ours actually needs some updating as well. So that's been a priority for us, and we are definitely going to make it try and user-friendly to the public. We understand that regulations are very complicated. Most of them are written in lawyer speak and are a little difficult to understand to the common person who's maybe not so familiar with regulations. So we're trying to make that a little user-friendly, more user-friendly, a little easier to access the information based by the species that you're trying to import and from what country it's originating from. We also are signing up for Gov Delivery. So I think almost every other agency in this room uses this service, and it's a way that public can get information about what's happening within that agency. So for instance, DSAT already uses GovDelivery, and we plan on signing up for that for the impact team, and that's a good way for us to get information out. One of the things that changes information for us yearly is the country status based on a canine variant rabies. So we actually, our group here, our rabies group, evaluates all the surveillance data for all the different countries and then assigns a risk to those countries based on rabies. And so that is updated yearly on our website, but we're looking to use GovDelivery to get that information out a little bit more effectively and efficiently. Plan for the next year is also replacing our permission letters with a formal permitting system like DSAT already has. So for a lot of the permission letters that we issue, hopefully within the next 6 months to a year, if all goes well, we'll actually go to a permitting system. And I cannot do it without the wonderful support of our team here at headquarters and also at our quarantine stations and our regional officers in charge. Thank you. And just while Lourdes is coming up, you will see there's about 6 or 7 slides on bushmeat. Although we do not have time to cover that right now, they are there for your viewing pleasure.
Yeah, we have plenty of that. Trying to do that.
Okay, I'm just being told that we're a little ahead of schedule, so I will cover these slides. So bushmeat, and it's meat hunted from wild animals, particularly from Africa. Includes non-human primates, wild ruminants, rodents, bats, lizards, snails, crocodiles, elephants. It's most often smoked. We are concerned about bushmeat from our animals that are CDC regulated. And what we most commonly see is bushmeat from our non-human primates, because that is, for us and our species that we regulate, that is the most likely source of bushmeat would be from our non-human primates. The bushmeat trade in developing countries, it's hunted by villages as the main source of food for their families, hunted by others as main source of income. And I just worked in West Africa over the past 2 years for the Ebola response, and I can tell you firsthand, bushmeat is all over. It's very common. It's just like us going into the store and buying chicken that's already cut up and processed. It's sold at roadside stands, it's brought into the cities, and it's exported to countries around the world. For us in the US, it typically comes in with air passengers. And again, arrival from Africa, 250,000 people a year. Comes in through cargo, and it can also come in through mail. Most commonly reported countries of bushmeat origin, now this data is a little bit old, it's kind of hard to track bushmeat imports, but you can see the top 3 countries and then the list. We actually conducted a focus group study here at CDC, and we partnered with the Bushmeat Crisis Task Force and Zoo Atlanta. We conducted this focus group studies along West Central African expats in 3 cities. And the goals of the focus group was to determine why people desire bushmeat, acceptable alternatives, and improved targeted messaging. Bushmeat, the feelings about bushmeat. So when we interviewed these people, these are their comments and their thoughts and perceptions about bushmeat. And for them, bushmeat is fresh and wholesome. It's safe as long as it's properly prepared and stored, and as long as you don't ever overeat it. Most individuals polled had eaten bushmeat, and most individuals knew where to get it in the United States. That would not be me. I do not know where to get that, but I'm sure other people do. And I have a CBP officer smiling in the back of this audience, which you probably can't see, but he obviously knows that it's pretty common here. Substitutes were difficult to identify. We were having a small conversation prior to this webinar. When you see bushmeat, it is really hard to identify the original animal species that it came from unless you have some identifying feature like a hoof or something like that attached to it. So even though you'll hear from other groups that may be concerned about, agencies concerned about bushmeat, our regulated species, it's primates, non-human primates, but when you have dried meat, it's very difficult to discern that that's actually the originating species. And for them, bushmeat is considered more fresh and wholesome than the meat that's served here or provided in the United States. Possible alternatives: smoked venison, turkey, or chicken. Most knew that the bushmeat importation was illegal, so I guess that's good. Education's working. Still coming in, though. Some confusion over commercial imports and whether purchasing the meat from stores was illegal. Feelings about wildlife: they have a feeling that bushmeat and wildlife are actually different. Individuals didn't really understand concepts of biodiversity or sustainability, and they felt that wildlife reproduced at a sufficient rate to replenish itself. Conservation was also not a priority when we interviewed these folks, and reasons listed was poverty, hunger, and war have to take precedence. What is the best way to present educational materials? It's great. We can put out all the information we want, but if it's not in the right format, if it's not in the right language, it's not going to get into your intended audience. So they trust their family and their friends the most. They're very active in social media, social networking. They have little trust in the media. Regularly read newspapers online from their countries of origin. They are open to being contacted again, which is great, and open to hearing messages about conservation restrictions on importation and disease transmission. We also have had in the past selected bushmeat blitzes, which is targeted inspections, selected flights based on country of origin, selected postal facilities, multiple agencies involved, including CDC, U.S. Fish and Wildlife, and CBP. Other activities: we collaborated a collaborative study with the Wildlife Conservation Society, samples collected from bushmeat confiscated at 3 points of entry in the U.S. Samples were stored in liquid nitrogen, and they were sent to different labs to test for organisms that may pose a threat to human health. The results were that evidence of viral DNA and RNA, such as simian foamy viruses and herpes viruses, from a variety of samples. So that was the end for bushmeat. So I guess, are we caught up in time? And the next, Lourdes will introduce the next speaker.
Before we go to the next speaker, I'd like to remind the audience, the participants, to please email your questions, if you have any, to ipwebcast@cdc.gov. We have dedicated staff to take your questions. Again, ipwebcast@cdc.gov. Our next speaker comes from USDA APHIS. Dr. Deborah Duffy is a senior staff officer with the National Import Services, where she and her team, Dr. Saeed, evaluate the importation, transit, and release requirements of regulated animals, animal products, veterinary, biologics, and other related materials, as well as genetically engineered organisms. She will present APHIS import permitting veterinary services, organisms, and vectors. Dr. Duffy?
Thank you, Lourdes. There we go. Okay, so again, I work for USDA APHIS Veterinary Services, National Import and Export Services, and my cohort and I, Dr. Saeed, are in the Organisms and Vectors Permitting Unit. Our charge is to regulate organisms and vectors that are moved into the country or across state or territory lines, and we do that by means of a permit. I've given this talk a few times now, a few years, and each time we do it a little bit differently. And this time I'm going to use the approach that we're going to follow an application through the application process. So this is our application process, and don't worry, you'll see this slide again. The process starts with the researcher, a university medical researcher, pharmaceutical R&D person, public health lab, or veterinary diagnostic lab. Those people need to know when is a permit required. So what we have is some information out there on a web page, giving most of that information, a general broad categorization of what we permit. You can also email us at ov@aphis.usda.gov, or you can call at the number listed. A permit is required to receive livestock and poultry pathogens from outside the state or the country. And those pathogens are usually bacteria, viruses, fungi, and parasites. When you're moving materials within a state, intrastate transport, there is no permit required. We don't have the authority to regulate intrastate movement. We also control the movement of vectors of livestock or poultry pathogens. Those would include insect vectors like mosquitoes, ticks, beetles, flies. And sometimes there are vectors that are associated with the import itself. For example, the media that the virus was grown on might have been nourished with FBS, or the virus may have been grown in egg, or porcine trypsin might have been used in the processing. A permit is also required for movement of killed pathogens and their vectors and their derivatives. That would include antigens, vaccine components, DNA, and RNA. Again, if a material is exposed to animal media, such as eggs, FBS, those are the two major ones. Even if it's not a livestock or poultry pathogen, it does require a permit because these are vectors. Not every organism requires a permit. We don't require a permit for movement of non-pathogens such as yeast, mold, lactobacillus. We don't control human pathogens. CDC does. But we do control zoonotic pathogens that can cause disease to livestock or poultry and humans. And also, of course, we require permits for pathogens of humans that are not pathogens to animals, but that have been exposed to media of animal source. When a permit is not required, we have a list of guidelines that can allow their movement into the country. This is our list right now. It's available on our website. What we recommend is that you look up the guideline, print it out, read it, follow the directions on it, which usually require that the shipper writes a statement including some certain information about that material. The guideline and the shipper statement on their letterhead would be included with the shipment to come into the country. So in summary, for the applicant, do I need a permit? We control movement of livestock or poultry pathogens and their vectors. So if we have a pathogen or its vector, and we're moving it interstate or importing, a permit is required. That is the VS Form 16-6, as opposed to the application, which is the 16-3. So now we have a killed pathogen or its DNA or RNA. Again, if we're importing it or transporting it across state or territory lines, a permit is required. A non-pathogen that's been exposed to animal media that is going to be imported, and this is important, the animal media exposure and the import. We don't regulate this stuff for transport. So it's a non-pathogen exposed to, non-livestock poultry pathogen exposed to animal media for import requires a permit. Again, the permit is the Form 16-3, and it's shared by the organisms and vectors staff and with the animal products staff. It can be for interstate transport or import. So how do you apply? Our web page has that information. You can apply through our system, this e-permit system. You can send us an email at ov@aphis.usda.gov. You can apply through the U.S. mail or FedEx or UPS, or you can fax. So application form 16-3 becomes a permit 16-6 for the interstate transport or import of controlled organisms and vectors. We do not require permits for in-state transport. Everything, after we get the application, everything is conducted within the e-permit system. And that's important because when you're deciding how to apply, and we'll go over that here in a second, e-permits is really the best way to apply. There is some help, a help desk for e-permits because sometimes it can be technically challenging. And there are some FAQs on the e-permit on this site here. It used to be really hard to get access to e-permits because you had to get e-authenticated. And to do that, you had to go to a local USDA office and bring in your license and whatever. But it's a lot easier now. You don't have to see anybody in person. You can make a phone call. So at the data entry stage, if the application was not submitted through e-permits, then it's hand entered. And that's why it's faster to submit through e-permits, because the hand entering can take 10 minutes, or it can be 2 days before they get to that section to hand enter. At that point, the people that do the data entry will also collect fees. If you submit through e-permits, you can also have e-permits take out the fees from your account. You'll get a receipt and an application number. At this point, it's decided whether this VS 16-3 application goes to organisms and vectors or to animal products, and they'll be routed to the appropriate team. So again, in the data entry section, the applications are hand entered into e-permits. Before we process, we collect the application fee. And in this order, the fastest processing occurs through e-permits, if you submit through e-permits. Second is if you send email or fax. And if you want it to take 3 days or longer before it gets into the system, you can send it by FedEx, overnight, UPS, or USPS. And I'm just saying that because it's just physically, they come to our office, they come to the mailroom, they have to get shipped to this place and that place, somebody has to go pick them up, and so it's not faster like you would think. The next step of the process is where the permit is drafted, and that's, if anybody has made applications, you know that that's Sue Collins. She's been with us for a long time, and she knows her stuff. She'll assess the completeness of the application. She'll ask you questions if we need to know something. She'll ask the staff officers questions if she thinks that we need to ask anything. She'll initiate inspections if required, and she'll draft the permit. Other things that she does is she enters lab inspection documents into the application. She keeps a database of lab inspections, and she communicates with our service centers who do the inspections for us. So speaking of inspections, we try to put restrictions on our permit that would prevent importation of classical swine fever, African swine fever, swine vesicular disease, foot and mouth disease, high-path avian influenza, and Newcastle disease virus. We usually restrict countries where those diseases occur, but if we can't do that, we'll have to have safety testing at our foreign animal disease diagnostic lab in New York or our diagnostic veterinary lab in Iowa. As far as biosafety levels, veterinary pathogens do not necessarily have BSL levels. Those levels were designed for human diseases. But in the biosafety and microbiological and biomedical laboratories, Appendix D, there are some veterinary and zoonotic pathogens that have been assigned, usually a BSL 3 or higher biosafety level. And we usually go by those same biosafety levels. The lab inspections are conducted by our national import-export services service centers that are distributed throughout the country, and usually a local veterinary medical officer will inspect. And we have select agent inspectors. We accept the select agent inspections, and we accept the IPP inspections. So when is an inspection required? It is related to the organism. These are some of the criteria that we look at. Is the organism a national or OIE reportable disease? Is it endemic to the United States? What is the importance to the industry and the economic impact of this disease organism? What is the level of pathogenicity? How is it spread? What is the infective dose? What is the mode of transmission? What is the risk of spread to animals in the area? Would veterinary services respond to an outbreak? And is it an emerging pathogen? So then we want to know, how is it being used? Is it just benchtop work, PCR work, or are we culturing this material? Are we injecting it into lab animals, or are we injecting it into livestock and poultry, which we are very concerned about? As mentioned earlier, the BIMBL is the basis for the inspection checklists. We have a lab database that's in the e-permits, but the database is not all that robust, so often you have to tell Sue that you've had an inspection, then she can look it up and find it, usually. The inspections are valid for 3 years. The approval of the labs is based on the local inspector. We trust their judgment because we can't be there ourselves. If there are deficiencies, the senior staff officers address those with the applicant. There's a little typo here. CFR 9, section 130 covers the inspection fees. There are fees for some inspections and not for others. The next section of the application process is when the senior staff officers get the permit. We review all those things that we just talked about, the biosafety, the use, the country of origin, the disposal method, et cetera, whether we have jurisdiction, and then we approve, deny, or send a letter of no jurisdiction. This really complicated slide is what we do, what the senior staff officers, how we determine what needs to be done with an application. So select agents, if they're viable select agents, they are not permitted. If they're ready for use veterinary biologics, vaccines, or diagnostic kits, they don't come to us. They go to our centers for veterinary biologics. If it's intrastate transport, we do not write permits for intrastate transport. So then you get to the black box. Is it a livestock or poultry pathogen, derivative, vector, biological specimen of those organisms, a killed pathogen or DNA, RNA extracts? We do permit those. If they're not listed here, and you go to the no that's on your right, and they're for import, then we want to know if it's been exposed to animal-derived media or egg, and then we might need to have a safety test. If it's for interstate transport on the left, all we do is look at the organism and the use, determine what the biosafety level is, and write the permit. Again, import, you always have to look at whether the material was exposed to animal-derived media or eggs. At the next section of the process, the data entry person is also the person who processes at the end. They send a permit with a cover letter, letter of no jurisdiction or denial. Again, the permit's good for 1 year, and they close the file. And then we're back up to the applicant, who is expected to abide by the conditions on the permit and is expected to read the permit. That's very important. There may be some compliance inspections periodically. They're generated randomly, and we go in and check the paperwork. The applications are renewed yearly and amended as needed. Again, we have some web tools. Within this web page, we have answers to questions about whether a permit is needed, frequently asked questions, guidelines when no permit is required, the list of foreign country disease status where we decide if the FBS, comes from a country that is free of FMD or not, and the application form. Our contact information is here. Best to look at our web page. I'm done. Thanks.
Thank you, Dr. Daffisey. Before we go on a break, we would like to remind the participants to please submit your questions to ipwebcast@cdc.gov. We have dedicated staff who are waiting to get your questions. Again, ipwebcast@cdc.gov. We will now break until 1:50, and we can get together back here at that time. Thank you.